I think advocacy is so tricky. Um, and I think maybe my focus, I really appreciate courageous parents being parent focused, because on the medical side, I think my focus is how do we make practitioners better listeners, so that all parents are able to and empowered to share their perspective. And I really see that as my work, and hopefully some way that I can contribute to learners and to our health system. And how do we figure out how to be better listeners so that parents and patients share their important stories to allow us to provide the care that is best for them. um, Advocacy from the parent side can look really tricky, because I know parents have talked about, well, if the team likes me, then my child will get better care. If the team doesn't like me, then my child won't get good care. They won't come in here as often. They'll think that I'm complaining. Um, and to put parents in that spot of already they are in such a vulnerable position because they have brought their child into our care, their most precious thing. They have brought their most precious thing into our care. And now they have to figure out how to be liked by us so that we take care of their children in the right way. For me, that feels like shame on us as a healthcare system that we've set things up that way. I have had many Black moms say to me, if I ask questions, if I tell the team something, they hear that as aggression. They hear that as I'm being difficult. And I know that. And then I know that my child won't receive good care. And yet, if I don't tell them those things, then they won't know those things. So what do? I have to tell the team, I'm worried about this medication. I'm worried my child won't take this medication. We've tried that medication in the past. It hasn't worked in the past. But then when I say that thing out loud, because of the way people see Black women, they're going to see that as me being aggressive. And so parents will say, I'm really stuck. I don't know what to do. And I feel like, well, that is not a parenting problem to solve. That is a health system problem to solve. There is nothing else that I would ever want to do with my life other than being a pediatric palliative care provider. It is exactly what I wanted to do with my life before I even understood what those words meant. And it absolutely fills my cup. Every visit with a patient and family, every space they let us into, fills my heart, empties my heart. It is really a tremendous privilege to be allowed to do what we are allowed to do. And yet it is sometimes really hard to be a part of a system that has so many challenges in how we partner with patients and families and how we invite them into those spaces, and the harms that we inflict on patients and families, especially on patients and families of color. It feels hard to be complicit in that. And there's a pull inside of me to apologize that I continue to stay and work in that system. And then there's also a pull on me to promise that we are all hoping and trying to be better listeners, and to figure out a way to partner better together, knowing that we want the same outcome as health professionals. We want the same outcome that parents and patients want, which is as good of a life as is possible. That's what we're all trying to get to. And on our health system side, we've had a harder time figuring out how to get there for everybody. But I do think that we are at a particular time, a moment in history where there's more openness, where there's more understanding, where there is change that is happening. And I remain hopeful that we will figure out a way to be better partners to patients and families in the future.